The Pagosa Springs Medical Center comes in and I'm so glad they dropped by today. Tamra Lavengood and Heather Nobles. She used to be our babysitter, and look, now she's working at the hospital. Good morning, you guys.
Good morning.
Is that all right? I said that.
It is 100% fine.
It's true. I don't know if that might say how old I am, but I don't know. Whatever.
Me too.
But welcome, you guys. Good to see you. And Tamra's the Director of Clinic Operations, and Heather Nobles is the Physician Assistant at Primary Care there at PSMC. And I've seen your picture in the paper, so I kind of knew, I knew what was going on. And Heather, tell us a little bit about everything, like how you got here.
Certainly. We've been back in Pagosa for about the past year now, and prior to that actually grew up here, and so I'm a Pagosa native, and it's been kind of a fun full circle moment to get to come back, and now as having a career as a physician assistant, getting to be able to do that here in a small town and be at PSMC.
Yeah, and I remember your parents. They had wolf tracks over there near the city market. And so, wow, this goes way back to, 20 some odd years.
It certainly does. It does.
Anyway, so what a great job now you have at the hospital. And what a fun group and great place to work.
It is.
Right?
Very much.
So tell us about the primary care department. And I know Tamra knows a lot about it too. So, I mean, you guys have been here quite a bit, but our listeners there might be some new listeners, or they might want to be reminded about what goes on there in primary care.
And we might have a new provider that we have to introduce.
Okay.
Yeah. So, Heather, tell us about what is a physician assistant, because that's always just, questions come out about all the time.
Yes, certainly. I think maybe one of the easiest ways to explain what a physician assistant is, we are licensed clinicians who practice essentially in every specialty, in every healthcare setting. We are licensed to diagnose, treat illness, and to prescribe medications to patients. And PAs are typically educated at a master's degree level, and then we include classroom instruction as well as 2,000 clinical hours where we gain our experience before we have our physician assistant degrees. And going back to my role in the primary care setting, PAs can provide almost all the clinical services that physicians provide, including physical exams, diagnosing and treating illnesses, prescribing medications, and certainly I think, especially in our hometown, we're critical to increasing access for rural and underserved patients.
That is perfect. See, that is why we hired you.
So yeah, a little more history, Heather. Like you lived in Houston and also Golden, and you were doing
correct
medical studies. In those places.
So backing up, graduated high school here. Yay, go Pirates!
There you go.
Certainly. Anyway. Then I received my undergraduate degree from Fort Lewis College, so kept that local as well, and then went on to spend some time within the medical setting trying to figure out what I wanted to do in medicine, and lived in Tulsa, Oklahoma, worked in a surgical suite for a while there, and then attained my Master's of Physician Assistant Studies down at the University of Texas Medical Branch in Galveston, Texas. So, yeah, and then in terms of my most recent years, I spent the past 4 years up in the greater Denver area in Golden, working at a family practice there. And then most recently have done a wonderful year of pediatrics over here in Durango, and now I'm happy to be here in Pagosa.
Yeah, clearly you like Pagosa because you're back, and that's so cool.
I do.
Yay.
Right? It's a good place.
Well, and in Pagosa,
a little bit, maybe.
It has for the better, I would say.
Yeah, I think
it's been a fun moment in terms of coming back and getting to re-explore and relearn Pagosa.
Yeah.
Heather, what do you like about Pagosa?
That's a great question. I think I have really grown to appreciate certainly the natural beauty that we have here when you spend time away and then you get to come back. It's one of those things where you realize exactly how beautiful this area is, and you don't have to share it with tons of other people like you do on the Front Range. We have some solitude here, which has been wonderful, and get to enjoy it with my husband and also my two kids.
That is so cool. Now, I shouldn't ask this, but how old are your two kids?
That's fine. I've got a 2-year-old and a 4-year-old, both girls, and it's been fun getting to come back here and raise a family here.
And when I think about that, you're going through all of your training, and then you have a young family. See, that just shows the motivation to serve Pagosa.
I agree.
Pretty cool.
That is cool. So tell us about the patients for, at primary care and in your department. What kind of patients do you see there?
Yeah, certainly. The role of primary care is we see all ages, so from birth and little teeny babies all the way up until our grandmas and grandpas and our older folks who are within the community. And certainly with my most recent experience of a year working in pediatrics, I certainly enjoy seeing children of all ages. But in primary care, we see everyone.
And that's what's so cool, because you can follow families and you can have multiple generations in your practice, and then you just know the ins and outs, and you're better able to take care of our population.
Certainly, that's one of the most rewarding things about being in primary care, is getting to delve into not only some of the physical ailments, but certainly just all aspects of patients' lives, and viewing them as whole people and not just, hey, you're a body with a clinical illness.
Mm-hmm. And then trust is probably one of the most important elements of you as a provider to establish with your patient, because without that, they really don't listen to suggestions. They have to develop that trust.
Yes.
And you've been with us for how long?
Almost a month now.
Almost a month.
I thought it was longer. Okay, wow.
I'm brand new at the clinic, so come see me.
Oh, there we go. Yeah,
because
you are accepting new patients, and then just because we're moving toward a team-based model, you are a team member of Dr. Julie Buchner, of Aaron Singh, and just sharing that panel of patients. So then that really provides that medical home, and that's what we want to do.
Yes.
Yeah.
Fantastic. So Tamra, you've been here quite a bit. You're kind of a regular on the radio now.
And it's so fun.
And it's so fun, right?
It is. Well, thanks for always inviting us back.
Of course.
I think it's cool that we get to just present, what's going on in the facility to the whole population. And, everybody knows everyone's name here. I just love it. Close-knit family in Pagosa. Mm-hmm. So what's interesting is that right now in our clinic, we are moving toward something called value-based care, where the outcome is more important than just seeing a whole bunch of patients. And what's really cool is that the Center for Medicare, Medicaid, and several payer groups are all on board with this, offering basically incentives for primary care to have the time to take care of you during your visit, to be able to not just run you in and out, because it does take that element of trust. And then also just the whole idea that it's really shared decision making. When you guys, see a patient, it's not all about the provider telling you what to do. It's really, sitting back, looking at where the patient, where you guys are coming from in your life and what's going on, because that affects how we're able to take care of ourselves. So that is it's a real shift in how we're, providing care to you. Mm-hmm. The main thing is it's kind of a process, and we are in that process right now. We're not there, but it starts out with, it's called empanelment, and it's where we want every patient, every one of you guys that come to our clinic to be connected to a provider, a provider team. It just makes a difference. And the team that I'm talking about is having a physician and then having someone like Heather, a physician assistant or a nurse practitioner, and then you have probably at least 2 MAs, and that's called a medical assistant. These are the people that walk you back once you get into the clinic. They're the ones that take your height and weight, just what we always want to see. Right. And, our blood pressure, what is our oxygenation doing? And so that is the first element of coming into the clinic. Actually, the very first is a stop-by registration. And we
or maybe call first?
Yeah.
Call in, or
right?
do you expect people to call, or can they drop in? Maybe it's better to call, I would think.
Well,
for primary care.
That's perfect.
Introduce yourself and say, hey,
there you go.
I'd like to drop by. I don't know.
And that's exactly right. So we have scheduled visits where patients are scheduled with the providers, and then we have a walk-in clinic.
You do, yeah.
That is, where you can come in with non-acute situations and not have to go to the emergency department. There are definitely times where you need to go to the emergency department, but for most of the ailments that we have, just as people, it's not an emergency, but we need to be seen. Like right away, we wake up and we have a sore throat, or we've twisted our ankle the day before and now it's really swollen, and we just want to get somebody to look at it. Where I'm, from out of town and I'm having difficulty breathing at a higher elevation, and just to be able to have a place to walk in, and we take care of everyone. But the majority of our patients are scheduled. We probably see between, I'm going to say 15 and 35, patients walking in during a day. So, so it can be very busy.
Yeah. So you mentioned registration.
Yes.
Right. Is that near the front door or no?
It is right now.
Right
now. You come in the front door and you register. If you're walking, you just go directly back to the clinic, and you'll be told to do that. If you come in like with chest pain or really difficulty breathing, then registration will send you over to the ER. So we always ask, is this for an emergency situation or not? Then just having a different registration in the clinic, and those are for the walk-in patients. We actually register you down there. That's what we're doing currently. And
so for appointments, you call 970-731-3700, the main number there?
That is exactly right. And then
some people might be shy, so, I'm just trying to help them along.
Yes.
Because they may put it off, and it's just not a good idea.
Absolutely.
Get after it.
Absolutely. And you can always call. The thing that I wanted to mention is that our phone tree is changing, probably the end of March, 1st of April, where you will be selecting a care team. And, it will say the care team of Dr. Jason Wallace and Phil Zappone, a nurse practitioner, press 1. But then there's always the option of pressing 0. And there's always the option of, if you don't have a care team, if you're not assigned to somebody, we will still take care of you. And there will be an option for that. So we are just trying to, give our patients a medical home, and where they know the people really well that they come in and work with. And that is that whole element of trust that we are really going to foster.
I agree.
Yeah.
And that's why we do this show, just to introduce people and build that understanding and trust and all that, and get to know you guys.
Yeah, that's right.
Which is very cool. So anyway, we're speaking with Tamra Lavengood, Director of Clinic Operations at the Pagosa Springs Medical Center. Heather Nobles, just starting as a physician assistant, primary care. And it's 20 past. We'll take a quick break and come back and see what else we can talk about here in just a minute. Let's hope the computer's working, but here we go. We'll be back in just a couple of minutes. Alley House brings us Good Morning Pagosa, and so does the Pagosa Daily Post and Mountain Eye Care and Edward Jones. Thank you very much. And we're back with Tamra and Heather from PSMC. So anything else? Where did we stop? Where did we leave off here just before the break?
I have one other thing that I wanted to mention. So the thing that we've learned, and this is just across the nation, is that about only 5% of our population take 50% of healthcare dollars. So it's like, okay, so what can we do to lower cost of care and to keep our patients healthier? First of all, is really identifying those patients that, as we get older, we get several chronic conditions, diabetes, high blood pressure, weight management, just a whole slew of things. And so if we can just help those patients who are, really sick, still just stay out of the hospital, stay out of the ER. So one of the things that we're doing is that we hired an RN care manager. And this person is doing a great job of following up on every ED visit that we have, just calling them up, making sure that, you understand your discharge instructions, that you have everything you need so that you don't come back in, and then following up with every hospital discharge. And that's probably the most important. You're sick when you go into the hospital. And so when you leave, we want to make sure that you come in and have a visit with your provider, and that will keep you out of the hospital. So that is the role of the RN care manager, and then also identifying those really complicated patients and reaching out to them, like in the interim where you might be having a provider visit every 3 months, that we can have just a check-in every month where someone's calling you and saying, how are you doing? Sometimes we're even getting a cold, or we're, something else is happening, and to address it sooner than later. So that's the whole idea. And Heather, I wanted to ask you, because you've been part of teams, team-based care, and having a care team, and what did you think of it?
Yeah, I think it is a wonderful new model that we're trying to go to in terms of really, I think, allowing all the providers and staff on a healthcare team to really work to the highest level of their training and education to really help us provide the best care that we can for our patients.
There we go.
Mm-hmm. Team-based care. That's cool. New model. Right here in Pagosa. How about that? You don't have to drive to Durango.
That's right. That's right.
Wherever.
Yeah, and the goal really is to keep all of you just healthy to the best degree that you can. And then another focus is really looking at preventative care for primary care.
That's what exactly.
Getting your cancer screenings, getting your immunizations, having an annual visit. I mean, we take our dogs and cats in for annual exams. We need to do the same thing for us.
Ourselves.
Yeah,
right?
we do.
Well, that's what I was saying about being shy, or kind of maybe, just waiting and, not thinking but not doing. Mm-hmm. So I don't know. Mm-hmm. Yeah, so people out there, just call them, get set up, 970-731-3700. It's a fantastic facility. We're so lucky to have PSMC here. And that's something that's really changed, right, Heather? I mean, remember 20 years ago? Oh. I don't even think we had hardly a clinic, right?
Wow. We didn't. It has been a really fun shift to come back and see this gorgeous new facility we have. If you haven't come to see the new building, it's beautiful.
It is. Yes, it is beautiful. And huge windows. You can look out and see the mountains. It is. I mean, probably the prettiest clinic I've ever seen.
I agree.
Yeah.
Well, great. Thank you, guys. Thanks for dropping by. Have we covered it? You think we're good, or anything else you want to say?
Oh, I do want to say that we have opportunities for employment in probably every area, especially in the clinic. I mean, we're looking for family physicians. We are looking for nurses, RNs. We're looking for MAs. We're looking for the business support, which are the people that are in the front registering, the ones that are making your appointments for labs and radiology. We're looking for a licensed clinical social worker. We only have one, and behavioral health integration is so important in primary care.
Marcia,
yeah. And we have this new position that I haven't written the job description for, but it actually is an idea that we have needs that have to be met before we can take care of the illnesses. And we need to identify, are you able to get housing and electricity? And, what about food? All of these things are so important to address first. So we're going to try to have a staff member be able to first identify what your needs are, and then be able to just give you the resources in Pagosa, because there are really good resources. So lots of jobs.
Right. So
come
are
and
you
apply.
The recruiter, Tamra? No. Okay. Sounds like you're doing a good job. So, I mean, if people want, maybe go to the website and look and see what jobs are available, and that would be Pagosa Springs Medical Center. I mean, just Google that. but PagosaSpringsMedicalCenter.org, and then look for your job there. Sounds like a busy place. Wow. And I was just wondering how you recruit, because some of these are specialized, but not all. You probably need just administrative type people too.
You don't have to have a ton of experience as long as you are, hardworking, pleasant, committed, dependable. All of those characteristics are what we're looking for, especially in business support. And even as an MA, we can train you in the areas that you need to know about. Just because there are no MAs in this area, as a medical assistant, the ones that walk you back. We definitely are in need of those individuals and willing to train.
So I just was looking at the website, and there's a patient portal too. So that's another way to get signed up for an appointment, right?
We don't have appointment scheduling quite yet.
Not
on the portal.
Yeah.
But you can ask questions to the provider. We'll get back in touch with you. And definitely a service. You can look up your lab. You can look up your radiology reports. It is providing access to your care through the portal, through visits, through the walk-in clinic. There's access.
And walk-ins are 7:30 to noon, and then 1 to 5?
Yes.
Okay.
Actually, 1 to 4.
1 to 4.
1 to 4.
That's your primary care walk-ins, and the emergency department 24/7, of course. And boy, they're busy. Huh? The scanner upstairs is always coming. Oh man, you guys. Well, thanks so much. All that you do at the medical center for us here in our community. Thanks so much. And
well, thank you.
Yeah, thanks, sir. Good to see you again. Well, thanks for having me.
Yes, welcome back to Pagosa and the medical center. Fantastic. And Tamra, thank you.
Oh, you are so
Come back
welcome.
And see us again.
We will.
Okay,
we
good.
will.
And everyone, thanks for tuning in.